The primary sources for cancer treatment are usually surgery, chemotherapy, radiation, or a combination of all three. However, researchers and scientists are continuing to make progress in CAR T-cell therapy. In that process, a patient's T cells, which are a type of immune cell, are removed from the body and genetically modified before being transferred back into the patient. This type of genetic engineering makes a patient's own T cells even more powerful to kill cancer. Recently, Anixa Biosciences announced it has completed and validated the reformulation of the viral vector necessary for its CAR T program. Here to discuss more is the president and CEO of Anixa Biosciences, Dr. Amit Kumar. Thank you for joining us.
Thank you for having me, Stephanie.
Tell us more about the status of Anixa's CAR T program and what it means for the future of cancer treatment.
Well, we're working with the Moffitt Cancer Center to develop this CAR T approach that's addressing ovarian cancer initially, and then perhaps some other types of solid tumors. As CAR T is a revolutionary new therapy that has done amazing things for certain leukemias and lymphomas, but has not worked very well for solid tumors. And our approach is a slightly unique approach that we believe will enable this technology to work in initially ovarian cancer, as I indicated earlier, and then additional solid tumors.
As you mentioned, Anixa states that the specific tumors that the CAR T has been effective in humans are all diseases of B cells, which are a type of white blood cell, such as leukemia and lymphoma. Why has there only been success in these types of cancers?
Well, the whole area of CAR T technology is relatively new, and we're learning a lot about differences between solid tumors and, in the case of B cells, the way that the approach works. In the case of B cells, this technology has done amazing things and has generated a lot of interest in using this type of platform for solid tumors. In our particular case, we've identified a specific protein on ovarian cells that our T cells, our genetically engineered T cells, will be able to target. And animal studies have shown that we've been very effective at destroying these cancer cells. And we want to eventually, by the end of this year, early next year, begin human trials at the Moffitt Cancer Center with this technology addressing ovarian cancer.
Going back to that ovarian cancer, scientists have revealed that CAR T therapy will kill healthy B cells as well as the cancerous B cells. However, Anixa takes a different approach to CAR T that instead targets a protein receptor found on the surface of those ovarian cells. Tell us more about that process.
Yes, we found a specific protein. It's called follicle-stimulating hormone receptor. That's a protein that's utilized throughout a woman's life in sexual maturation and control of creation of eggs, et cetera, et cetera. And it only exists on the ovary cells in a woman. Now, we will attack those cells using the CAR T that we've engineered, and we will destroy healthy ovarian cells as well as the cancerous ovarian cells. But typically, when women contract ovarian cancer, they tend to be postmenopausal, and women can survive easily without their ovaries at that time.
How is Anixa's approach to CAR T different from rival therapies?
Well, there are a couple of unique mechanisms of action. In our case, we've identified a very, very specific protein that doesn't exist on any other important organ system in the body. So our T cells will go and attack only the ovaries in a woman. In addition, we believe that these T cells are also destroying the vasculature or the blood vessels that are supplying the tumor lesions nutrient and removing waste from those tumor lesions. So we believe that we have at least a dual mechanism of action that we think will enable this technology to work against solid tumors.
February this month is National Cancer Prevention Month. Where can people go to learn more about Anixa Biosciences and its CAR T-cell therapy?
People can come to our website. We are a publicly traded company, traded on the NASDAQ. And people can also look at on our website some of the publications regarding this technology. We're working on a number of other technologies as well, so one will have to focus exclusively on the CAR T area, and we've got those publications available.
Dr. Amit Kumar, thank you so much again.
Thank you very much, Stephanie.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.